Hi, this is Mike Berkley. I'm the founder and director of the Berkley Center for Reproductive Wellness here in New York City. And it's Tuesday, October 12th at 7:18 a.m. So I want to tell you a little bit about me and my history and why I'm here and what potentially I may do for you. So I'm 65 years old and I'm blessed enough to have a wonderful 26-year-old son. My wife and I had a great deal of difficulty conceiving. I had anti-sperm antibodies and poor morphology, and she also had anti-sperm antibodies. I was a computer salesman at the time. This is going back, I don't know, 30 years ago, when we started trying. And, you know, we really didn't know what to do. We didn't want to do IUIs or IVFs. So I wasn't an acupuncturist at the time. As I mentioned, I was in computer sales. And my wife sought the help of an acupuncturist and an herbalist. And within 3 months of getting acupuncture and herbs, she was pregnant. And now I have a kid who's taller than I am, who's doing a master's degree in political science. So things seem to have worked out with acupuncture and herbs. And I guess within a year or two, I got out of the computer business and I started going to acupuncture school. And I went to acupuncture school for approximately 4 years and got my license. And then I went back for 2 more years and I got board certified in herbal medicine. And then I went into my own practice and devoted my practice to treating fertility cases. Of course, every reproductive endocrinologist that I came across and told my story to went like this. They gave me the eye wave as if to say, son, you're crazy. Acupuncture has nothing to do with fertility. Now, of course, as most of you know, acupuncture is an accepted modality of intervention to help contribute to clinical pregnancy rates and live birth rates. Um, I was actually the first acupuncturist in the United States of America to specialize in treating those with fertility challenges. And I've been doing it for about 24 years here in New York City, in Manhattan. And so I just thought I'd give you a little bit about my background, and now I'll give you a little bit of information about acupuncture and herbs in the context of infertility. So, if a person has polycystic ovarian syndrome, basically, why can't they get pregnant? Well, it's because they don't ovulate regularly. And when they do ovulate, their egg quality is typically not very good. As a result of that, the polycystic ovarian syndrome is twice as likely to miscarry as the non PCOS population. Why is this? It's because generally and typically PCOS patients have too much testosterone in the follicle. And there's testosterone and estrogen in the follicle, and they should be balanced, within normal range, within normal limits. And so, if a patient has hypertestosteronemia, too much testosterone in the fat tissue, and particularly in the follicles, it will be perhaps quantitatively greater than the estrogen. Estrogen is not only emitted from follicles, but estrogen also nourishes follicles and eggs. So if you have this insult to estrogen being excess androgen, you're going to have poor egg quality. And so the main problem with the PCOS patient is oligo-ovulation. They ovulate here and there irregularly, and poor egg quality. What acupuncture and herbal medicine seem to do quite consistently and quite effectively, though not always, but of course, IVF doesn't work always. But in any event, acupuncture seems to have a mechanism whereby it can frequently regulate the cycle of the PCOS patient. This is of critical importance because when the cycle is regulated, ovulation is regulated, and then the PCOS patient knows when to have intercourse for the purposes of conceiving. And so acupuncture seems to balance out the relationship between testosterone and estrogen. Of course, we'll use herbal medicine as well. And so we've had many successful cases helping PCOS patients to get pregnant, even if they're doing IUIs or IVFs, because many PCOS patients get pregnant with IUIs and IVFs. Many don't. And many of those that do end up having a miscarriage. So our protocol for treatment is we treat patients twice per week until they're pregnant, and then we treat them twice per week for 13 weeks because 90% of miscarriages happen within the first 12 weeks. So if we can get you to 13 weeks, you're probably going to have a live birth with a healthy, undoubtedly beautiful baby. So this is my little mini presentation on myself and on PCOS. I'll do more of these presentations on different pathologies like endometriosis, male factor issues, idiopathic infertility, which is to say infertility due to no known cause, chronic recurrent miscarriage. So just be on the lookout. If you'd like more information about what the Berkeley Center for Reproductive Wellness is all about, visit us at our website, which is berkleycenter.com, Berkley center.com. And if you just can't wait and you want to talk to me today or tomorrow or the next day, feel free to call me. I'll answer any of your questions, no obligation. You don't have to become my patient. I'm just happy to answer your questions and to help you. My number is 212-685-0985. As usual, this has been a pleasure speaking with you. I hope it's been helpful, and please be on the lookout for further mini presentations. I wish you Godspeed on your journey to family, and I really look forward to hearing from you and to working with you, and of course, to helping you achieve your dream of family. Thanks so much for watching. Bye.